Right.
Ready? Okay. So I have an eating disorder called Pica, which is eating non-food things, and it has two real factors that cause it. The first is stress. If I get severely stressed out, I catch myself eating paper, which, to answer some questions that I had last time, that's really all I eat. But the other thing is low blood iron, anemia, causes me to eat paper because my body goes, hey look, that is iron in it, I need that, so I will, and then actually it's not, it's negative because then the paper binds to iron in my blood and actually makes me more anemic. So then I want to eat more, and then it lowers my iron, and just a wonderful little horrible positive feedback loop. So for me, it really started when I was about 6. I was in the hospital room when a very dear family friend died, and it was not like peaceful, quiet. It was cancer, dying, not knowing who anyone was. So it was not fun for anyone in the family. I was very little. And that's really when it started. So I've kind of just been living with it the whole time, or since then. I, last semester, started taking iron pills because one day I not passed out, but sort of blacked out in class for a couple of minutes, which was a little bit frightening. And so we went in and, hey, did you realize that you should really be in the hospital because your iron is so low? So I've started taking iron pills, and that's helped both with the anemia and with the Pica, because I don't feel like I have to eat paper to keep my iron up. What was next? How it affects us. So there's, aside from the iron, there are a couple of ways it's affected me. One is it's, one is it's really not good. It's not something your body can handle, and so I have had times where I've had a sore stomach, or worst case was, and this is theorized, we don't know for sure, but we think probably what caused my appendix to be inflamed to the point where it was very bad was the fact that it got plugged up, and so the infection couldn't be handled by my body. But other than that, just sore stomachs occasionally. The other big thing aside from that and the anemia is just that it kind of has a stigma, and so it's a gross thing, I'm aware of that, but it's something you think about small children and dogs doing. So it's something where, especially when I was younger, not that I pull anything, it's something I get teased about, and just, it was sort of, it stressed me out. It's still, if people see me, because I'm terrible at hiding stuff, it stresses me out, which just is unpleasant, and it makes me actually, because stress is one of the things that makes me want to eat paper, makes me want to eat more.
Questions?
That's about it. Questions?
Okay, I don't want this to be like too personal, but like, how much do you find yourself consuming?
It depends.
Like, I guess what's the most and like lowest, if that's not too much?
When I was in 7th grade, there was that whole year I pretty much, I don't really remember except for maybe once or twice eating anything. Life was good, as I think what I said earlier. The most, when was it? I know within a course of a week I had pretty much an entire notebook once, which was one of those times where, yeah, my stomach hurt, because that's really not good for you.
Any other questions?
Does it have a stigma because other people have like urges to eat different things, or is it usually paper?
For me, it's just paper. For other people, it's like
You listed a bunch of things in the last hour.
chalk, cigarette butts. It's one of those things I have read about just because it's personal. cigarette butts, wood, all, pretty much anything. The stigma is, well, and maybe I'm misusing that word.
No, I think you're correct.
Okay. The stigma is mostly just because it's gross and sort of weird. So if, especially with little kids, when I was in elementary school, I got teased a little bit. Nothing terribly mean, just because it's weird and gross. So, yes?
I don't remember if you said, did you like find out because you looked it up yourself, or did someone like tell you that it was like, or did you always know of Pica, or was that like discovered later?
I don't know when I ever really got the name. I suppose it's one of those things I never like been to the doctor to have diagnosed so much. It's one of those things where it just, I don't know how much diagnosis is really necessary because it's just pretty obvious what it is. I've never really, when I was like 2nd and 3rd grade, I saw like, just the school had a counselor that I saw and talked about it, which was nice of them, but it really didn't do much for me the way they did it. But, so it's one of those things where I've never really sought treatment or never really had it diagnosed or anything. It just sort of is. Yes?
Is it one of those like uncontrollable like urge things, or is it something like, more like a craving for the eating the paper or something you want to do, but like how much of it is like under your control and how much isn't?
I mean, it's all stuff I can control. It's like any other action. It's just, it's sort of like, and I don't like relating it to food because it's separate from eating food, but like if you're sitting on the couch with a bag of potato chips and you just are sort of mindlessly, it's one of those things where if I'm aware of it, I can stop myself, but it's something that I just do, like people who bite their nails nervously or anything like that, where I don't always, it's just an impulse, so I don't always realize I'm doing it.
Is stress like the only cause of it, or are there like other factors that like not like trigger it but like cause it to happen?
Stress and then low iron.
Okay.
So if I'm really stressed out or if my iron is low.
Okay. Okay.
Other questions? Okay, thank you.